The latest on the coronavirus emergency. Lots of major developments overnight. The Trump administration has asked Congress for $2.5 billion to help fight the outbreak. This comes as the CDC issues its highest travel warning to South Korea, and the number of cases are growing there and in Italy and Iran. And now concerns growing at a hotel in Spain where a case was just confirmed. There are now more than 80,000 cases worldwide, and the outbreak is also sparking fears on Wall Street, the Dow plunging more than 1,000 points on Monday. We're going to have more on that in a moment. But first, James Longman joins us from Milan. Good morning, James.
Yeah, good morning, Robin. Milan is much quieter than usual, but as Italy does what it can to control this outbreak, we're seeing the dangerous potential for the spread. Infection breaking out from here to both Spain and Croatia.
This morning, the urgent race to stop the global spread of coronavirus and the potential for contamination now clear, as an Italian doctor has now tested positive in a Spanish hotel, forcing more than 1,000 guests to get tested. He visited the hospital yesterday with fever and COVID-19 symptoms, and he's now in isolation. All guests are being told to stay in their rooms until results are back. And in Croatia, the first confirmed case. A man also recently in the Milan region of Italy, the patient described as young and his symptoms mild. In Italy, the number of reported cases at over 200, an increase that World Health officials call deeply concerning. A number of countries now restricting travel to or from the Italian red zone, and Kuwait the first to stop flights to the country. 50,000 residents across 12 towns are under lockdown as the death toll rises to at least 7. The normally bustling streets of Milan, much quieter than usual. Dana Rogers from Wisconsin runs a business here.
My family's worried because you watch the news and you see the supermarkets and you hear about cities being quarantined. So my mom yesterday was like, I'm really worried. I think you should come home.
The number of cases also at worrying levels in South Korea. Overnight, authorities raiding the headquarters of this church in Gwacheon, where the first COVID-19 case was reported. Health officials trying to test its more than 200,000 members. As the World Health Organization struggles to figure out exactly how the virus is transmitted, health officials say it could turn into a global pandemic. The CDC issuing its highest travel warning, telling Americans to avoid all non-essential travel.
It's time to do everything you would do in preparing for a pandemic.
And in the US, the number of confirmed cases at 53. The effects of the virus felt far and wide, from Wall Street to Hollywood, where Paramount Pictures announced Monday it was stopping its production of Tom Cruise's Mission Impossible 7 in Venice out of an abundance of caution for the safety and well-being of our cast and crew.
And scarily, we're now seeing officials fall ill. The Iranian deputy health minister has been pictured on television, clearly suffering from coronavirus. Michael?
All right, thank you, James. We're now joined by our chief medical correspondent, Dr. Jennifer Ashton. And Doc, we see these cases popping up in many other countries now. So what does that say or tell us about the coronavirus?
Well, I think the first thing, Michael, is that we don't know if all of these other cases is the coronavirus or COVID-19 behaving differently, being more easily transmitted from person to person, or whether their reporting capacity is different and better than we saw in the past, month and a half to almost 2 months. When you talk about the numbers, I want to emphasize this. It's not the case number and the death number that really is important here. We have to look at how many are exposed, how many are infected, how many of those infected actually develop symptoms, how many of those people are then tested and test positive. Then we can calculate a severity rate and a fatality rate. And right now, Michael, all of those numbers have been elusive.
When we're starting to hear the word pandemic.
Yeah.
And how likely is that to happen? And is the world prepared for a virus to spread like that?
Well, the second part is the key question. In terms of the word choice and the language, it's more important to focus on the response, both here and in other parts of the world. But very interesting, Michael, in October, Johns Hopkins University did a global pandemic preparedness drill. They found that no country is fully prepared to deal with an epidemic or a pandemic. Only 19% of the countries they evaluated got top marks for detection. And look at that number, Michael. 77% of countries couldn't even collect or report data in real time. That's the problem here. So what happens in other parts of the world affects us.
All right, Doc, thank you for giving it to us straight. Appreciate it, Doc.
You bet.